Hello, I'm David Bishai. We're here in Minneapolis, Minnesota at the American Public Health Association. My guest here is Professor Glen from the Colorado University. And I'm so glad to have you with us to sort of bring your perspective on how Indiana was able to make advocacy happen and improve the funding in local public health. How do you think that was made possible?
Well, it was really remarkable to see the strategy involved there in Indiana. From my perspective, I was brought in as a collaborator and consultant, mostly on the school public health assessment of the public health system in Indiana, and I think that was a key part of their approach. Is they took a kind of a rigorous approach to examining the current status of the public health system in Indiana, using data from a variety of sources. We actually were able to use our research center to do some primary data collection for Indiana, some statewide data collection using our National Longitudinal Survey of Public Health Systems that gave Indiana a really detailed snapshot of current capabilities at the local public health system level in all of Indiana's local jurisdictions. They took our survey data, combined that with other state and national data sources to both to assess current strengths and gaps in the current system, but then also to model, potential opportunities for strengthening those capabilities as well. So I think the data and analytic pieces that were part of that assessment were one key ingredient, along with the community engagement and public health stakeholder engagement, that really effective job they did on the kind of soft side of developing a proposal for reform and improvement, and then getting all the stakeholders involved.
So I saw in the Fairbanks report references where Indiana compared as lower in terms of staffing per capita, showing they're below the national average, as well as funding levels. Was the Fairbanks report able to get those data quite easily, or what was the process that gave them access to the data?
Yeah, well, again, they use, like a lot of us in health services and systems research, they kind of used a variety of data sources. They did have access to some state-specific data sources on staffing and funding to supplement data, the imperfect data we have at the national level that I know you're well aware of. And so they brought national data to bear. They had state-specific data that was captured internally by the state of Indiana. And then we had the primary survey data that we were able to collect on a statewide basis for them as well.
So it was one thing to say that we don't fund as well, we don't have as many staff, but there'll be people in the political spectrum that says, so what?
Right.
Who say that all of this is a waste of money anyway, so they'd be happy to say, well, we're just not wasting as much money as those other states. So why didn't that happen in Indiana?
Yeah, well, again, I think that if you look at the assessment report that was done, they also did a good job of reviewing the scientific evidence about the health and economic impact of public health systems. And,
were they citing your paper with Charlotte Smith?
Yes, they cited our work. They cited the work of others that have done
Tim
this
Brown,
similar. Exactly, Tim Brown,
leader.
JP, all of those folks, our fellow travelers in public health systems research, and it was important that we had, all of us, including yourself, have been working in that field to begin to build more of that evidence base, and so that was part of what was leveraged. They used those data especially to then kind of simulate and project what could be the impact of enhanced investments and improved capabilities.
Indiana eventually had to reach out to the business community and say public health spending is good for business. How did that argument work?
Yeah, I mean that was, I think, another important part of their strategy. I think partly again, they were able to look to the evidence base to help to make that case. I think they also then did a good job of engaging with their healthcare system partners in being able to kind of describe that potential impact, and also to leverage the partnerships that health systems have in the business community as well. People who are serving on
I
the
see.
governing boards of
That personal
hospital systems.
relationship was additional to the data, and the
Absolutely.
relationship was almost as important, or perhaps more important than data and evidence.
Absolutely, I would say so.
So what other tips would we have for other states that want to take the Indiana model of advocacy forward? What would you give them as advice on how to make this work?
Yeah, I think looking at the multi-component approach that Indiana used of bringing sound data, specific data, local data to the argument, and doing a thorough and honest analysis, honest in terms of acknowledging where there are gaps and uncertainties, and there are many gaps and uncertainties in the evidence base for this kind of a reform. So doing the sound data and analysis, but also really strong engagement with public health and health system and community stakeholders throughout the process, particularly, especially at state level reform, making sure you've got both state and local stakeholders.
State and local all lined up.
Engaged.
To what extent was the governor's championing this the deciding factor? What if you're in a state where the governor is an average governor and not a champion? What do you do?
Yeah, well, I think that's where Indiana offers some instruction as well. I mean, their strategy of having the governor appoint a blue ribbon commission to oversee this analysis, including people that the governor knows and trusts as being an honest broker for these kind of decisions. I think that was very, very important, ultimately, for making sure the governor would understand and give credibility to the recommendations of that commission. I mean, I think that's a replicable strategy, regardless of political party affiliation. Having an independent, multidisciplinary commission oversee an analysis and recommendations in a commission that has members who would be trusted brokers with political leadership.
So getting the governor to appoint the commission gives him some political ties to the commission itself. He gets to name people he believes would be good for this.
Exactly.
Well, I wanted to thank you for your time, Glenn, and thanks for your perspectives on this important topic.
Well, great to be with you.
Great, thanks, Glenn.